We're looking at ionic inhibitors as examples of what antithyroid drugs. All right, and we have already spoken about the antithyroid drugs where we said that antithyroid drugs are basically drugs that they are against the production of thyroid hormone. Do you understand? So these drugs, there's a pathway that actually leads to the production of thyroid hormone. So these drugs will basically attack this pathway at different regions. Okay, so each drug has where they actually attack the pathway. We have already made videos on all the other drugs. This is the last one we're going to make videos on. So pharmacology of ionic inhibitors, antithyroid drugs. All right. So ionic inhibitors can also act as what anti-thyroid drugs, and that's what we basically trying to look at, right? So ionic inhibitors, including what perchlorate, can be considered as a what therapeutic option. That's when it is combined with what metimazole, right? So guys, ionic inhibitors, I can see the beta blockers right here. All right. So these drugs to okay, sorry, no. Ionic inhibitors should be this one, right? Because the perchlorates and are there, all right? So they can be used for treating iodinated contrast media induced what hyperthyroidism at the maximum daily dose of what 100 milligram up to 4 weeks, and for prophylaxis of what iodinated media contrast induced hyperthyroidism at what 1000 grams per day. Basically, they can be used to treat a type of hyperthyroidism called the iodinated contrast media induced. All right, and I have a video coming on the iodinated contrast media induced hyperthyroidism. So they can be used to treat this disease condition later on, and they can be used to treat this disease condition in like preventing it. Okay, that's where we say that it is prophylaxis. So looking at this now, ionic inhibitors, you could see the examples is what perchlorate, all right, then pentate and what thiocyanate. So looking at this image right here and comparing these chemical symbols here, SCN is what thiocyanate and ClO4 is what perchlorate. Okay, so this is where they actually act. All right, ionic inhibitors. So they actually prevent the iodine ion from actually getting into the cell, right? Getting into the thyroid hormone. So what is the mechanism of action? We say that competitive inhibitors of iodide transport mechanism. So as such, they block iodide uptake by the gland. Okay, so they are competitive. They're actually competing with iodide for the receptor. Okay, so they will stop it from actually going into the gland. So therapeutic use, um, KCl04, that's what you adding potassium to these perchlorates. Okay, it is used for treatment of what amiodarone induced hyperthyroidism. Right, what are the side effects of this drug? Aplastic anemia. All right, so for this reason it is rarely used. Okay, it can also cause aplastic anemia, so it's not really used like that. All right, so pharmacology of ionic inhibitors, antithyroid drugs, saw the examples, and basically we saw the mechanism of action where they actually attack the pathway that leads to the production of thyroid hormone at. Okay, guys, that's it about the pharmacology of ionic inhibitors, antithyroid drugs. See you guys in the next tutorial. Bye.